This is a microphone test. Yeah, so we're almost right in time. So I start very slowly, knowing that we will have a few more participants coming in over the next minutes. So a very warm welcome to the first web dialogue as part of a series that WASH United, some of you know us from the Menstrual Hygiene Day, and the Menstrual Health Alliance India is led by WaterAid India and Development Solutions and other partners doing. And today, our first web dialogue will be on the action for menstrual hygiene education with focus on India. So therefore, we're very happy to have you here. And the dialogue will be co-hosted by Tanya Dargan from Development Solution and Arundhati from WaterAid. So I will give them also the microphone now. Arundhati, should I give it to you only or to Tanya as well?
To Tanya.
Okay, 1 second. Mm-hmm.
But hello, everyone.
Yeah. There she is. Okay.
Hi, everyone.
Oops.
Okay. So quickly, we'll just wanted to. Hi, I'm Tanya Dargan Mahajan from Development Solutions, co-coordinator of the Menstrual Health Alliance India, along with Arundhati here. Thanks for joining us today. So what we are going to be looking at today is this. It's basically what we want this to be is a conversation, a dialogue, and not just a presentation by any of us. So we're looking at situating this conversation, in a review that we recently did of behavior change communication packages on MHM in India. But what we are looking to do today is to use some of those findings to trigger our thinking on what a comprehensive MH education package looks like, especially for low and middle income countries settings. And this discussion hopefully will be relevant for informing BCC for programs and policy on menstrual health and hygiene across different countries. So how we will be going through this discussion is that we'll share some of the key findings and the gaps that we have identified. We will open them up to our experts who've joined us today. We will also invite comments and questions from all of you who have joined us, and share closing comments in terms of recommendations and next steps and how we could possibly participate in addressing those gaps. The experts who are joining us today are, of course, me, Ina, Wash United, Alka Malhotra from UNICEF India. Alka has led the creation of Paheli Ki Saheli, which is a comprehensive BCC package on MHM, which has been adopted by many states in India. Lakshmi Murthy ji from Jatan Sansthan. Lakshmi ji has been working in MHM education for over a few decades now. So I don't think anyone knows the space better than her. And Nirmala from Kaboom has also been looking at MHM from a BCC lens for a few years now, and of course all of you. We also have joining the discussion Manju Lakshmi ji. She's the CEO of Sindhudurg district in Maharashtra and has actually implemented a BCC package at scale. So it'd be interesting to see hear some of her insights and experiences on this as well. So moving forward, yeah.
Yeah, so before we start in the discussions, I wanted to highlight why we're doing that and what is actually some of the data we have. And some of you participated also already. So some of you participated also. We, as a Menstrual Hygiene Day, we started to compile numbers to at least know what is the situation, the status of education around periods and menstruation. And we had submissions by over 300 organizations who said that in 2019, they will reach to approximately 41.4 million girls. And thereof, approximately 4.6 million are in India, but we have many more because there's a proportion number which is very large by UNICEF, Days for Girls, UNHCR, PNG, WaterAid, and Girls Health Ed. So the numbers will be much higher, especially also when you consider government contributions to that. So knowing that we're doing all this together to reach so many girls. And as Tanya said, so what are recommendations we can give to practitioners and policymakers to not only reach that number, but to reach that number of girls and women and boys and men with quality education and increase that number. So yeah, let's dive right in.
Thank you, Ina. So basically, talking about the review quickly, we looked at 18 BCC packages on MHM from across 14 development partners working in India. Most of these were comprehensive packages. 12 of these are comprehensive packages, and a few were direct delivery materials which could be used as part of other packages. Most of these, 14 of the 18, are available in languages other than Hindi and English, which speaks to the adaptability of these materials across different settings, across different contexts. But English has been used as the primary medium for development for most, which we also see as an advantage because that allows the material to be adapted across not just states within India, but also possibly other countries. We only included primary materials in our review. And this review was just for context supported by UNICEF India as part of an advocacy initiative with WaterAid India and partners. So moving forward, so in terms of what should MHM BCC look at? Like, what does behavior change communication for MHM look at? Of course, we need to look at biology of menstruation, menstrual problems, etc. But going beyond that, normalization of myths and taboos, it's also important to include, it allows for linkages with sexual and reproductive health conversations on pregnancy, safe sex, on management of PMS, on puberty in across both genders, actually, menopause, linkages with nutrition, especially during the critical period of entering adolescence. It allows for conversations on basket of MHM products, access points for these products, hygiene practices, which is one of the key reasons behind increasing RTIs due to unhygienic use of products, environmental impact and disposal, waste management, MHM-friendly wash facilities, and last but not the least, enabling conversations around menstruation amongst all stakeholders, because it's knowledge amongst girls and adolescent girls is only the first step. It can only translate into practice, and we're learning this more and more through various community programs, is if other stakeholders around them are informed as well. So looking at the coverage of key messages across the content that we reviewed, most of it looks at the biology of menstruation and normalization using facts around biology. Also hygiene practices and personal hygiene during menstruation and other days. And the focus on biology and normalization and hygiene. Of course, the biology is, it's intuitive because that's where the conversation around menstruation is pivoted. But the hygiene component seems to be focused because of the context of a lot of wash organizations having developed this materials to begin with. A lot of MHM work has come from the wash sector. The initial push has come from there. So that's why the focus on hygiene practices. Some of the topics that remain underserved in the content are nutrition, waste management, pregnancy, safe sex, menopause, puberty in boys. So all of the issues which are underserved are the ones which have interlinkages with probably other sectors that have not looked at interlinkages with MHM, including sexual reproductive health, nutrition, maternal child health. So that gap is clearly reflected in the coverage of key messages across the content. Looking at, and the most covered content, which is the biology of menstruation, here also we see that, the factual information that is presented on the biology of menstruation is extremely varied across all of the content, and we could not really come across a lot of sources for this information either. So for example, taking the length of menstrual cycle, what's represented in the content is anything between 20 to 45 days being the length of menstrual cycle. Sometimes it's represented as a range, sometimes it's presented as average. The duration of menstrual flow from, it's also highly varied from 2 days to 7 days, or saying that it should not be greater than 8 days. So there's not a lot of consensus seemingly in the content that's presented. And that also speaks to the lack of, focus and objectives through, for which these facts are presented, beyond just the normalization component. So of course, you're using these facts to normalize menstruation, but it's not necessarily being used to enhance health-seeking practices amongst girls and women on the basis of what is normal and what is not normal. So for example, and these are what we have presented here is actually the recommendations of how these components should be looked at based on the review of the content, a review of various literature, secondary literature that's present, which is also limited, by the way, and also inputs from field partners. So what we found is that, saying that a range of 10 to 16 years is the correct age of menarche allows a girl to look at what is okay, or a parent to look at what is okay, and at what point should they be going to a healthcare provider. One of the areas where this really stands out is identification of heavy blood loss. What is heavy blood loss? In many pieces, it's represented as volume. If the normal blood loss is 35 to 40 ml across the menstrual cycle, or greater than 80 ml is, not okay. But how does a girl measure that? There's no way for a girl to actually measure that volume. So something more appropriate is probably soaking a pad or tampon in 1 or 2 hours, and associated sort of indicators like dizziness. It's a more appropriate way of presenting this information, which allows the girl to know when she needs to go to a healthcare provider. And this also speaks to situating the content in the larger context of healthcare, health seeking, and enhancing healthcare access related to MHM. Okay, so just pausing here for a moment before going forward, I would like to open up, based on these insights on the content, just open up the conversation to our experts and ask a couple of questions on, given that there is so much variety of content available here, and Ina and Lakshmi ji, this is for you to begin with. Do we need country specific, or how can global or country specific benchmarks be established for these factual pieces of information that are built into the content at its very core? So Ina, you want to take this?
One second, struggling a little bit with the technology. I think with periods being a very normal biological process that's happening to all women and girls, there's a lot of things that are standard and can be standardized across countries. There are for sure a few differences, like around, as you said, the norms, around some of the restrictions and specifics. So I think we should be very careful on always using the right facts. I was very astonished to see that there's such a variety on the differences what documents and education guides quote. My recommendation is a good practice from Kenya, where the government has developed 18 key messages that every document that is being developed and distributed by an NGO or by the government has to include those 18 facts or like key messages. And those key messages and / facts, they're aligned with the education curriculum, and they're also being vetted by the experts in the country. And this way you get much better standard. And this can be reapplied to India, but it can, and also other countries. And maybe even as a global standard. Should I ask? There are the questions. Perfect. Lakshmi, I'll invite her to speak now.
Ina, I think we're having some technical issues. Sorry. Can you hear me?
Yes, I can.
Okay, great. Sorry. So you couldn't hear us at all. So it would be great if we could get on these on the issue of whether we should have global or kind of country-specific benchmarks established for this kind of factual information.
Yeah. How can health seeking be strengthened by incorporating
Okay, so maybe I didn't get it. So do you want me to repeat my answers? Or you want me to answer question number 2? Sorry, your connection was very bad. Or maybe we can ask Lakshmi to answer first. She should be unmuted.
Yeah. We were just saying that Lakshmi ji, if she can provide additional insight.
Okay.
Lakshmi sir. Okay, we seem to not have Lakshmi ji here. We have Manju Lakshmi ji from Maharashtra, who has actually implemented a lot of this in her district, Sindhudur. Manju Lakshmi ji, do you think, when you were developing this content, did you feel like, some of this was useful in terms of enhancing health seeking practices amongst girls and women? Or was it limited to talking to them about myths and taboos? What's been your experience in this case?
Unmute and speak. If you're having technical issues, just let us know in the chat box. Okay, I think someone is trying to unmute. So while we wait for folks who are trying to join, if anyone else just wants to share their perspective on this, please, please do so. You can just unmute and speak.
I don't, you have to raise your hand and Nirmala wants to speak. 1 second, I unmute her. So you need to raise your hand as a non-participant and then I can unmute you. Nirmala, I think you should be able to speak now.
Yeah. So, what you said about, I'm just posing the kind of issues that we come across when we are creating content, right? As Tanya said, I've been working on creating content, and there are certain things that you face on the ground when you're trying to find facts on menstruation. For instance, in Africa, like Ina said, the government's issued a set of, set of facts that need to be followed by everybody. But what is also true is that the commercially produced pads carry another set of information, and they reach more girls. So at one point, what we figured was there was a lot of contradiction between the information that was being provided by the government and by the commercially produced pads. So now, what one feels as a creator is that there is a huge lacuna there, and there is space for somebody to take up this whole space of creating facts and putting it out there. As Ina said, it's not very difficult to find these facts. They're pretty much there, but they need to be in that one place which becomes that go-to place for everybody else to go to.
Yeah, and I think just to add to what you're saying, Nirmala, is I think there are some things which have like a global appeal and global relevance, but we're also wondering, is there any kind of actual information that needs to be established that is more country specific or region specific? So, for example, I think something's related to South Asia or say the Eastern African region, which do we want to consider looking into those things and making sure that that information is then more easily available to these sets of stakeholders. So that's also something, we're not looking for answers, but just as a point of discussion.
So maybe as a point of discussions for, I think when you presented the key messages, there was very clear that you said there's very limited messages on sex and pregnancies. And I think that has been, for example, for us, a very conscious decision to leave it out because we wanted to keep our information very compact related to menstruation. And we also found it was opening up a very different discussion, and also for trainers and facilitators, if you add sometimes pregnancy and those discussions, especially will facilitate this. So I don't necessarily see this is always missing this aspect, but I wanted to emphasize what comes out a lot is pain management, and I also would love to see that we're more conscious about what we communicate around pain management. And yes, maybe a standard or standard answer and repository would be good around that.
Okay. Yeah. So maybe Alka, you might want to, you may have some perspectives here in terms of how you looked at the content resources for developing Paheli Ki Saheli, because this was even developed a few years back, and at that time I think resources were still more disaggregated. Are you able to hear us? Hear me and Arundhati? Okay, so all right, so basically in terms of not just the factual information on the biology of menstruation, but also comprehensive information on the basket of products. Most of the content that we covered looked at sanitary pads primarily, and this is when Nirmala probably, what you mentioned in terms of the content market being monopolized by the big manufacturers comes into play. But a lot of the content focuses on sanitary pads. A few content pieces focus on cloth pads and related management, but there's very few packages which comprehensively cover menstrual cups and even compostable, disposable sanitary pads. So in terms of development of content, what challenges have you guys faced in finding this information, or what resources did you access? How could this be point of learning for others who are trying to develop information more comprehensively around products? Alka, would you be able to provide insights on this? Okay, anyone who might be able to chime in on this point in terms of comprehensive information on the basket of products?
Can you hear me?
Anyone who wants to participate in the discussion, provide comments, could you please, there's an option for raise hand, unmute me and raise hand. So could you just click on raise hand, and then Hina will be able to unmute you.
Can you hear me? Can you hear me?
It's below the list of participants. So the questions basically in terms of providing comprehensive information on the basket of products. Content developers, there's not a lot of comprehensive content out there. So is that because of a lack of resources? And if you could guide us to the appropriate resources for accessing that information.
So Ina here, so I see a few, so finally I'm back on technology. So I see a few raised hands. So Pallavi, Omkar and Lakshmi has raised their hands. So I give first, Lakshmi should be able to listen. And so we have first Lakshmi, then Pallavi and then Omkar to answer. Okay.
Can you hear me?
Yes, we can.
Yeah,
we can.
Oh, great. That's great. Okay. No, so I was just thinking, see, I pasted it on the chat too. Pads and cloth are mainstream information as opposed to sponges and tampons and cups, etc. So when we want information about non-mainstream products, it's there, but it's all scattered. And, you have to look up many sites to, figure out what you want to share with your participants or with your community. So one option is to have a single source information for pros and cons of these products. Okay, now the other issue that we've had in the field is wanting to be safe as an implementing agency. By safe, I mean, for example,
okay, in the interest of time, maybe we move on, compiles on the responses later and get back. And if you have comments, Lakshmi ji, Karthik, Omkar, Pallavi Ben, if you could just type them in the chat box, we will take note and share
It's
with
typed
everyone.
already.
Yeah, sorry about the technical glitches. So in terms of looking at the stakeholder ecosystem, you know, a comprehensive BCC is not just something that reaches the core target stakeholder, which is the girls, the adolescent girls and the women, but also their larger ecosystem around them. And for that, to posit that, we use the UNICEF socio-ecological framework, which looks at, from the individual standpoint, adolescent girls, women, girls and women with disabilities and special needs, older women from an interpersonal communication perspective. So these are the people who will help translate the knowledge that girls gain into practice. Older women, mothers, mothers-in-law, peers, adolescent boys, and other men in the ecosystem. Yeah, and societal environment in terms of frontline workers who are able to provide this information in a larger context, teachers, healthcare providers, women's groups, and at the public policy institution level, you know, administration structure, so local administrators, governments at various levels, who are able to, you know, set up infrastructure and institutional arrangements to make sure that information and facilities are available to girls and women. So from that perspective, we found that most of the content that exists out there is available and relevant for adolescent girls. While it's been created for adolescent girls primarily, it is also relevant for other groups like older women and mothers, peers, frontline workers, community groups, local organizations. However, in order to take this content to these stakeholders, some tweaks need to be made in terms of the delivery tools and methods that may be more appropriate, but the message and the content exists. So with some additional work, the same content could be adapted for some of these other stakeholders. However, there's limited relevant content for prepubescent girls and special needs, girls and women with special needs. Some organizations like WHSCC have done work on this aspect, Jatan, but it's still quite limited in terms of access and also breadth. Boys and men, again, some organizations like Jatan have done extensive work on this, but it's limited to those few. Sensitization content for administrators. Even in our work, through the Alliance, we found that this content is missing, and to be able to convince administrators to formulate certain policies which are informed based on evidence, there isn't a lot of standardized content available right now. So that's again a gap that we've found that exists. So based on this, we also, there are a few questions that we would like to ask some of our participants. First of all, and Alka, it would be great if you could chime in here if you're able to join the conversation. So should an MH education package be able to meet the requirements of all these stakeholders, or we need to develop different materials for these different target groups? Like, is there some sort of like a midway that we can figure out, or do we have to develop different kinds of content for all of these different groups? Alka, are you able to?
Should work now for Alka. Alka, can you say something?
Yeah, Omkar is also, chimed in. He's saying that recently they had a session with mixed audiences of prepubescent and pubescent girls, and they did have a tough time. So that's a specific gap that we also find in the materials that exist.
Can you hear me now?
Yes, we can.
Oh, perfect. So I think that when you say different stakeholders, what kind of a definition are you speaking of? Are you saying that there should be different materials for mothers and girls? I say yes. Do we need different materials for fathers and from girls? I say yes. And I think that's what we attempted to do when we tried to do the Ammaji videos, different from the Paheli Ki Saheli content, because the Paheli Ki Saheli content is explaining the physiology of menstruation, which can work for girls. It's immaterial, it doesn't matter. They shrug their shoulders when you share that with fathers, right? Or with boys for that matter. So yes, you do need different materials for different stakeholders, or different MH education packages for different stakeholders. The one thing that you might be able to use in a common education material is something around the discussions on the taboos, because that needs to happen commonly. The same with fathers, the same with mothers, the same with brothers, the same with the girls themselves. That's the only common package that you can have, and that links very closely with gender roles and responsibilities and gender stereotyping that happens in society. Over.
That's extremely useful, Alka, and that actually opens up the question. So if we do need to look at different types of content materials for different stakeholders, what does it mean for implementation at scale? So it would be great if Manju Lakshmi ji can chime in on this. Ina, she's raised her hand. If you could unmute her, and Pallavi Ben, both of them or either of them, to understand if in terms of a decision maker at the ground, if you're looking at compiling a package and reaching multiple stakeholders, how would you do that in a cost effective manner if the content is spread out across different types of modules?
Yes.
Hello everybody, Manju here. Can you hear me?
Yes, we can.
Yeah. So I was just typing out in the chat message only about the materials suiting to different age groups. Like recently, we had a basic MHM material prepared out of IEC funds of SBM, and when we expanded to older women, about we had done a survey and we had included older women from till the age of 40, and most of them are already part of our SHG groups. So we added a module on menopause. Even in the slides, the second slide that you showed regarding the BCC slide, I think menopause was one area where it was having, the lead. So that is one module we added there. We also added a PCOD module for the general MHM package that we through which we are reaching out to adolescent girls, basically from 8th standard to 10th standard. So these are two additions that we have done. So I believe that you need to tweak your material. You can just supplement the basic MHM material depending upon the age groups. With regard to funds, I believe you should not tax one particular departments. Like I am chipping in some funds from the Beti Bachao funds that we have receiving from the central government, plus SBM we are depending on exhaustively, and some of it from the Samagra Shiksha Abhiyan. So we are trying to pitch in all the department, make it everybody's baby, and we are getting funds from all these departments for printing out materials and for carrying out the trainings. If you have any,
that's interesting, because the fact that you need to generate funding for sustainability and for scalability from different sources, because like you said, MHM is not any one person's baby, but making it everyone's baby is also a challenge. So identifying those linkages, if you're doing Samagra Shiksha Abhiyan, then the education specific linkages. If you're doing Beti Bachao, Beti Padhao, if you're doing, if you're using health funds, RKSK funds, then some.
Yes.
Right now,
also we are using the NRLM funds, because we have a huge army of SHG women. We have almost 9,000 SHG groups. So we are using the NRLM funds, the National Rural Livelihood Mission funds. They have funds set apart for training. So that also I have been diverting it for focusing on the older women. Otherwise, I don't think we will be having a serious crunch of funds if we are looking at only one ODF plus MHM, which is like the general earmark. Like under the Samagra Shiksha Abhiyan or hello?
Yes, we can hear you.
So under the Samagra Shiksha Abhiyan, under NHM or under Beti Bachao, there is no specific funding which is actually directed to MHM. Even under SBM, since menstrual hygiene management is a part of the ODF plus, we are using the fund. So I think other departments, we have to create the linkage ourselves, and we have to design the programs and allocate the funds.
Right.
as
Okay. So one related question is, since we have you here, is also that, okay, since all of the different funding has to come from these different departments, and if you look at from a donor perspective, possibly, globally, we also have donors who are looking at WASH, who are looking at SRHR, livelihoods, nutrition, so pulling in funding from different kinds of donor sources, then how do you create ownership of the material that it doesn't get lost?
As of now, I'm working in a very small district, so I have not been able to garner much of funding from otherwise. Exclusively, we have been running this program on government funds. But I think the material as such, we had we had created some groups initially when it began with the UNICEF programs. I think the material itself was designed with the inclusion of the adolescent girls. So I think there is ownership of the material at that level. But and generally we are making master trainers among themselves. Like we have teachers, we have the community resource persons from SHGs who themselves are speaking out to their peers. So there is an inherent ownership of the material and the training material, and that happens when you make themselves the master trainers. It is not an external agency that is coming and preaching to them. We are just training a few of them, so they themselves are talking. So I guess there is ownership at that level. To a great extent.
Okay. So I think that also lends to the point of Sarthak just mentioned that the importance of including Gram Pradhans or village level heads, in a decentralized system, because they are going to be owning that material. So including some sort of monitoring or programmatic targets within the village level development plans would be key to that level of ownership.
So we had conducted training at all Gram Panchayats, and we had selected 5 representatives from the Gram Panchayat. So basically there will be a Mahila Sadasya from the Gram Panchayat who was also included, like the Anganwadi Sevika or the Anganwadi helper, the Asha and the Gram Panchayat Mahila Sadasya, and 1 SHG representative. So I think the Sarpanch, mostly we have reservation also. So you have a lot of, lady Sarpanches and lady Gram Panchayat members who have showed a lot of interest in this. So we had made modules for Gram Panchayat levels, and they have all been very actively participating in the training program. So not necessarily the Sarpanch always, but maybe a Gram Panchayat member who is a woman has been part of the training process.
Okay. Does anyone else have any questions? If yes, they can add to they can type into the chat box, or you can speak up now also by raising your hand. I think Manju Lakshmi ji also made an important point in the sense that if we want to engage and if we want to create ownership of MHM at a decentralized level, then we also need materials for sensitization and training of these decentralized nodes, institutional nodes, as part of the BCC package, which Paheli Ki Saheli does have that, and I guess that was
so I have to say something, and that's not about the material, but about the use of the material. Sure. I think there is a part about training, which is fine. One can continue to do a lot of training. However, I think at some point in time, any program that is using content which encourages girls and other community members to discuss MHM issues, a very important aspect of that, which is actually a social norm, is the taboo around menstruation discussions. Therefore, it's very crucial that not only are we tracking the quality of training that is happening, we can track that, that's an easy fix, but we also need to track the quality of discussions that are happening at the community level. Because our experience of implementing with partners such as Sarthak and in UP, Bihar and Jharkhand was that menstrual hygiene management, whether you use Paheli Ki Saheli or any other content, girls get it in 2 turns. It's not rocket science. They understand how to manage the period, they've been doing it. They understand how to manage the pain, they've been doing it. What they need help with, what we need to facilitate opportunities for, is discussion on the taboos. I come back to it because that's the social norm. And I think we need to be tracking the quality of discussions that are happening at the community level, because the taboos can only be rattled, if I may use that word, or if there is enough discussion on the norm around silence. And the norm around silence can be broken if the girls are given opportunities to speak about it among themselves. Mothers speak about it among themselves. There is an opportunity for dialogue between girls and mothers. There is an opportunity for dialogue at the community level with fathers and brothers. So it goes back to the point about discussions and tracking the quality of discussions that happen.
Right.
Over.
That's also an interesting and very important point is, again, a BCC package needs to be able to enable those conversations between different stakeholders, because that's the key between translating knowledge into a change in actual attitudes and practices. So the girl might be aware, but her actual practice of, norms and myths related to menstruation or hygiene depends on the knowledge of other stakeholders around. So that's critical.
Yeah, Tanya, so maybe Ina here. So I wanted to really emphasize when we say behavior change communication. I'm not so sure if this is a good terminology for menstruation. As Alka said, they're already managing it somehow. And it's also not about the knowledge per se, how your menstrual cycle is and the pros and cons. Is really about your agency as a girl, as a woman, how to talk about it, to talk about it, and also be brave to question and find your own solutions. So I like when you said behavior, like behavior is also the talk among actors and then the engagement, but I'm always not so sure if behavior change communication is the right terminology on what we want to achieve in terms of making people who menstruate and their community breaking taboos and stigmas. But if we all agree that here in terms of behavior, we really think about the attitudes and the silence, then I'm fine. Yeah.
Yeah, absolutely. No, you're absolutely correct. So we will sort of document some of these opinions and perspectives as we try to find answers. In the interest of time, let's move to the next sort of subject, which was looking at the participatory tools, which is, in terms of the various packages that we reviewed, and we looked at what are the kinds of participatory tools, and we found broadly 5 types of tools that are there across all the materials. There are either activities which can use local materials. So, for example, doing the red dot activity of normalizing menstruation using sindoor, which is the local material. Verbal stories. So, for example, Ruby's World, which is Russian United based, but even sort of more colloquial local stories that the facilitators are equipped with. Activities with predefined materials. So, a version of the red dot campaign which uses paint rather than sindoor, which is more local material. So the facilitator actually has to carry that material with them. And then there are pre-produced tools like the menstrual wheel, the As We Grow flipbook, WSSCC's multiple comic books. And these tools, of course, is something that a frontline worker would have to take with them whenever they are going to take a session or wherever the session is happening. Those materials would need to, the facilitators would need to be equipped with those tools. Then the last is the 3D replica or materials, which is the examples are so either a 3D model of reproductive system of the female or male reproductive system, or also the actual basket of products, which seems to be very effective in terms of improving informed choice about products. So having a 3D model obviously helps in terms of the understanding, the retention, but also has its related disadvantages in terms of cost and the ability of the facilitator to carry it. So all of these have sort of pros and cons to them. And some of the participatory tools we found to be used widely across a lot of materials are female apron, used to talk about the biology of menstruation, purity and impurity of menstrual blood, the menstrual wheel, which we used to talk about the cycle and safe sex and contraception, the As We Grow flipbook, which is based on Jatan's covered flipbook, and Chetna's earlier versions of the covered flipbook is puberty and gender roles and norms. So we can see that all of these tools have one core message, but they are also providing these opportunities for conversations on sexual and reproductive health, on gender, on gender equity, on gender-based violence, the snakes and ladders game, which is widely used across by a lot of organizations, talks about a rational approach to myths and norms, but can also be used to talk about hygiene practices and PMS and remedies. So broadly the insights were that while many of these tools are used across and been used across most of the packages, the messages that are being used or they are being used to convey are not necessarily comprehensive. And that's where the linkages with sexual reproductive health, nutrition, and all of these other sort of ecosystem, other sectors get limited. So how can we widen the use of these tools for broader range of messages is something that's sort of out there. So one question that comes to mind here is that, and Lakshmi ji, you if you can unmute and if you can participate now, and see if we can hear you, is what really needs to be kept in mind while selecting the tools for a comprehensive package, because you have this wide variety of things which are already available, which can allow you to speak about a lot of different messages, but what are the different factors that you need to keep in mind while selecting them? Yeah, and Ina, if you want to add more on the method and the tool, that would also.
Yeah, I think there is a distinction between a method and a tool. Like a method can be, we want to be frontal, interactive, and so on, and then the tool to use to achieve that. I wanted to throw in a little bit of a critical question in addition to your first question, is why do we need a comprehensive package? So because we, in our experience, have seen that if you want to integrate education into, for example, a sexual reproductive health package, like education program, or in Andhra Pradesh, where they talk about girl empowerment and have 5 different topics, among which menstruation is one, and they give you only maybe 45 or 90 minutes. So how comprehensive can you be? Or what is the essential package? So I think it's great to be comprehensive, and it's great to have time to be comprehensive when you have the funding and the tools. And then, yes, then it's great to think about selecting tools. But if you only have 45, 90 minutes, what is the essence of a compact package? That is what we ask ourselves. So, and yeah, we selected tools based on costs. That was our we'd choose method, but the costs were based on the tools we selected were based on costs, so keep it low cost.
Sure, that's an absolutely I think interesting perspective, that if you're looking at MHM as a module as part of other sort of larger conversations, then it doesn't necessarily need to be comprehensive, and we could look at it as multiple modules that fit into other larger conversations. So from that perspective, if you only have 45 minutes, then what tools would you look at? In terms of course, cost is a very big aspect. And if we were to do, advocate with any state government to adopt any BCC package, cost becomes an even more important, factor. But what other things could we look at to make it the most efficient sort of module rather than comprehensive?
Lakshmi, you should
Anyone who would want to
that.
Yeah. Yeah, I think Lakshmi is having some connection issues. Yeah. Okay. Anyone else who has perspectives on this?
So just this is Arundhati. I think there is also how we define comprehensive. So at one level, when I think of comprehensive, is that when we are providing information of girls, are we providing them the related set of information that they need to be able to have a healthy period and maintain all the hygiene that they need. So I think comprehensive is sometimes in the sense of providing all that, their entire value chain of information. And the other way to look at comprehensive is also that we need to engage all the right stakeholders. And that we're working with those who also want to have something for their mothers and their fathers and their boys in their school. So,
Nirmala, we can't really hear you talking. It was really
Oh,
a bit wide awake.
oh, I'm
Maybe
so
you can
sorry.
come closer to the microphone and repeat.
Okay, sorry. Is this better?
Perfect, now better.
Okay, so I mean, I think related to this point, how we look at what we mean by comprehensive package, and there are two ways. One
Sorry,
is that
Arundhati, still breaking.
is this better?
No, sorry.
Oh.
I pass on to Nirmala in the meantime. I think.
Yes, please do.
Okay, Nirmala, you're unmuted. So please.
Thank you, Ina. So I just want to combine, the last bit that you were talking about methods and tools and the comprehensiveness of a package and bringing all of this together. I think somewhere, if we look at extremely comprehensive packages, we will see that they are stronger in parts, because as organizations, we all have our focuses, right? I mean, as someone who creates contents for different organizations, everyone tells us that this is our focus point. And I think that is what is the focus of every product and every MHM tool, and not really the focus of an MHM tool cannot be whether it is about pain management or about teaching puberty. It has to be, as Alka put, the clear focus of the UNICEF material is how do you get the girls to open up and start talking, or the focus of Ruby's world is how do you bring agency into girls. Now, as if we're creating materials comprehensively, and I don't mean including everything that is to know about MHM, what is important is to have that central idea that you want to convey and be very, very clear about that. Once we're sorted with that, I think the tool itself starts working. The problem comes in when we want to include everything at the same time. And I've been reviewing a lot of comprehensive packages, and you see that, there are points where they're great, and then there are points where they completely lose focus because they don't know what they want to talk about when it comes to disposal of waste, because they as an organization don't work on it. It's not an expertise, it's not an expert area. So these are the kind of things that we need to start looking at when we start creating content or even using the existing contents. Over.
Can you hear me now? I don't know.
Yes, we can.
Yeah. Oh, okay, great. So, Nirmala, to your point exactly. So I get it. Not all of us are adept and have the skills to provide that information on all aspects of menstrual health and hygiene. But I posted in the chat box that we need to be looking at comprehensive information perhaps in two ways. And one is, if we are looking at that adolescent girl and say we're looking at her in a school setting, we do need to provide her with that set of information. So it's like the actual information on menstruation, the biology. There's the entire component on social norms, taboos, restrictions, etc. Then there's the thing about the products and hygienic use, and then there's waste management. So that can be comprehensive, and I think that I would say is important. But the other way to look at comprehensive package is that we understand that our primary audience is the adolescent girl, but in order to ensure her menstrual health and hygiene, we need to work with her mother and the boys in her school and other community stakeholders. And how do you develop a package that has something for each of these? So I mean, I think we need to be looking at it from these two lenses as well. Just a thought up.
So thanks, Arundhati, for the clarification that comprehensive doesn't need to be only the content you to provide to one stakeholder. I would just jump in for the second point. We would love to be more comprehensive, but the funding and the project funding we get is not considering to be more comprehensive. If a donor only wants to see how many numbers of girls are going, that's where we put the efforts in. It's really, really sad, and I would love to do more with mothers and community members, but sometimes we cannot sell that as well. And in terms of how, I would recommend to everyone to really use a user-centered design perspective, where you look at, and then that's where we work together with Nirmala extremely well to develop Ruby's World. Is like, what is the user, your stakeholder, what is their situation currently, and what are they looking at, and what do you want to achieve with them? And then you don't come with a health experts' perspective, but really catch them where they are and where they have to be. And I think UNICEF C4D is using exactly the same approach. But yeah, as I reiterate, would love to be more stakeholder inclusive, but sometimes we can't. We just can't.
Okay. Ina Manju Lakshmiji wants to add. So she says that they had basic booklets and pamphlets printed from open source materials, but they are not great quality, and they have a doctor and a teacher and an SBM resource person who is in charge of preparation of the materials. So, you know, there's clearly a lot of, like, a big gap in terms of access to good quality materials as well. And Manju Lakshmiji, you can speak more to it and how you try to solve this problem.
Hello, can you hear me? Yeah.
Yes.
So we had, I was actually listening to what you and Tanya were speaking about the various games. You mentioned about Snake and Ladder, then Ruby stories and all. I don't think we have been very innovative with regard to the material. We have very basic, some pamphlets. We had, for the girls, we had printed it out in the shape of a butterfly. And I had brought it for that summit, the seminar we had in Delhi. So we had basically two materials, one that is exclusively for the girls, and one which caters to a larger age group of women also. But I think considering the funds that at our disposal and the manpower at our disposal, we had using, people who are having other work, like the teacher, for example, is from the Sarva Shiksha Abhiyan. The doctor I'm using is a BAMS worker from MHM, but she has been she's also in the core committee of our the MHM activities. So this is the only material, and this is the people that I can source at my level, considering the manpower constraint and the fund constraint. But I think we have been able to use some of the material which was made available by UNICEF initially, some of the material which you had given in the WaterAid program in Delhi regarding disposal and regarding the accessible toilets and all. We had inculcated that also in the recent, reprinting of our material. So what we do is at a local level, I think rather than going for with talks of comprehensive material and uniformity, I think people who are working in local self-governments like me, like the Jilla Parishads, or even the Panchayat level or the Taluka level, I think we have to make good with whatever material which is currently available to us. But it would be great if you can create a pool of all the training materials which are available, which you did to an extent in the Delhi seminar, so that we can inculcate it in each of our trainings, that in our ensuing trainings, and make it more interesting. Hello?
Yeah, we can still hear you, Mani Lakshmi.
Yeah. So I would also like to get some feedback on how to make these sessions more interesting for the girls.
Yeah,
Hello.
Yeah, so I think that your point on making a repository to look at, and I think that came up also in the chat box by some other participants, on having a repository and then seeing the differences of the different tools, what they cover, what methods they use, and then you can see what would be a good fit for your situation and your location. I wanted to ask you, because you also wrote you have a few of the doctors available, and also ask others to the question, so effectiveness of facilitators, being it your teacher, your trainers, how do you work with them? How do you motivate them? How do you make it easy for them and it's also engaging for them to educate?
Actually, another thing that I want to put forward is, all my facilitators may not be having the same educational background or the same qualifications. Like I have teachers almost, I think I have teachers who are trained, who have been trained to be master trainers. But along with them, I also have Ashas and Anganwadi Thais, and also, the SHGs, the CRPs, the community resource persons. So in an effort to reach out to larger women, in an effort to increase the scale, at times we have to compromise on the quality of the facilitators. So I intend that, hello?
Yes, we can still hear
Yeah.
you.
Yes. So in an effort to reach out to a more number of women, especially after a survey and in which we found that older women are not, using safe adsorbents, then I think we were trying to reach out to older women. So I am having to make that compromise of, settling with the facilitators who are who may not be as qualified as a doctor. There are doctors also, but there is also a community resource person who may only be a 10 standard pass, or even not even maybe less than that. But she is also acting as a master trainer. She is also trying to reach out to the SHG groups and the village, organization. Only thing is she would rely on the material. So I have my doubts regarding the quality of the training also imparted regarding that.
Yeah, exactly.
But,
that was my point. Yeah.
But if I restrict my number of trainers, then I would not be able to reach out to so many women.
So designing something or have materials that are for an average person and not like the key champion. Yeah. Just wanted to say we're a little bit over the time now. We will continue the discussion because we had a few technical difficulties, which I hope you excuse for the first web dialogue we run. So we will continue a little bit. Stay with us if you want. Feel free to leave if you want. So trying to make up the time that we lost in our technical glitches. Okay, moving to Tanya again. Thank you, Manolakshmi, for your contribution.
Yeah. Okay, so we are towards the the last sort of topic for discussion today, and what we wanted to discuss was about this whole, we haven't talked about comprehensive. So this is actually related to that. I mean, MHM menstrual health. One of the first pieces of work that we as an alliance did was bring together sort of a definition, or that's the gap that we heard from most of the stakeholders working on the ground, and we try to develop a value chain that covers all of the different aspects, which includes access to products, which includes use of products, hygienic use of products, menstrual waste management. And then we realized that even within this, the cross-sectoral linkages of education, nutrition, pregnancy, safe sex, health seeking for RTIs, livelihoods, gender, all of these are still missing. So we have to sort of enhance this definition of our value chain. But related to this, it's a question that keeps coming up is, how should we look at MHM education? Should we look at it as a standalone thing, or should we look at it in an integrated format? And you had raised some very important point in terms of availability of funding and how that really impacts whether we look at MHM as standalone or integrated. But if we were to advocate for more integrated MHM education, what would be the different pathways that we could look at? Ina, if you could.
So for me, okay. Yeah. I also was seeing if Sheetal wants to say something because she raised her arm. So, so from a global perspective, not from the Wash United perspective, I think it's really interesting to see the comprehensive sexuality education, which is not from the WASH sector, but more driven by the education and health sector. And I've been to the global conference on population control, and that will be a key factor driving country commitments to increase comprehensive sexuality education. So that is like from a global perspective, more general, to look at opportunities to strengthen there. And these are like actors like UNFPA, also UNICEF, and who are working on this. And for us, on a private level, yeah, we were very happy in the when we were in Andhra Pradesh, where menstruation got integrated in the Kishori the Kishori phase, where it's where menstruation is one of 5 topics, and we had no influence on the other 4, but it's about seizing opportunities and offering it. So I don't see it's an either or question. It's more about get it in standalone or get it in integrated. No matter if we reach a girl with messages, it's better to reach her with no messages.
Okay, just, yeah, the first step is to get it in no matter what, and maybe then slowly build up towards, yeah.
I just wanted to ask a question on this. So when we say that it should be an integrated approach wherein we also talk about sexual education and pregnancy and other stuff, how do we deal with, so few of the stakeholders, like few of the schools, they are very much conservative about the information that the NGOs give. So when we talk, even when we talk about MHM sessions, they tell us, for example, they tell us don't talk about the religious aspect, don't talk about the taboo part. So how do we deal with all this then when there is a restriction from the stakeholder itself? So then they don't allow us to, then they become very much possessive about the content that is being delivered.
Dr. Shadra, sorry, we only get half. So can I repeat? So how do we push menstruation when there's limitations from the donor or the stakeholder perspective?
No. From the stakeholder, yeah.
Okay. Maybe some other people explain their experience based on your experience in India. I think you're much better placed.
Yeah, I think Lakshmi ji would have great insights on this, but unfortunately, I don't think she's able to join. But whatever, actually, I can chime in here a little bit on whatever we have, learned from different programs, Jatan's work, Tata Trust's work, Aga Khan's work. You cannot reach the girl and the woman effectively until you sensitize the stakeholders who sort of act as the middlemen of community level practices. So it's the same thing of you need to reach these different stakeholders to be able to effectively transact change at the community level. So often programs have taken the route of going to the girl or the woman first and then looking at all of these other ecosystem stakeholders. And it seems like now there may be a sort of a turnaround where we are looking at, first going to the stakeholders, whether it's administrators, sensitizing them, then going to frontline workers, sensitizing them. And then after that ecosystem is ready for taking that messaging to the girl and women, then going to the girl and women and other community level stakeholders. So that's one way of looking at it.
Yeah. So how do we deal with the principals or the NSS unit of the colleges and everyone, where we are actually dealing with educated people, right? So I sometimes go so speechless that how am I supposed to make them understand that this is also an important topic?
I couldn't hear the last sentence.
So I'm saying that at community level we can kind of sensitize a bit, but how do I deal with principals of schools and colleges? So if my stakeholder is a school or a college, and the principal or the management themselves restrict me from the content that I want to deliver, so how do I deal with this?
Yeah, any good experience that is here in the group that you can share, how you overcame restrictions or hesitation or limitations from college principals, authorities, let's say like this, how you overcame that, right? So yeah, raise your hand if you have experience how you did that. That would be great to hear. It's a great question.
Don't know if you can hear me. So I think this is a really relevant question, Dr. Shadra. Thank you for putting it out there. I think this is something that any of us who have had programs in the field will come across. Teachers, principals, you name it, they are uncomfortable with it, especially if we're doing it for the first time. A few ways in which we've done it is, one is that sometimes you need to go to them repeatedly.
I can't hear you, your voice.
Can you hear me now?
Yeah.
Okay, so one is sometimes you need to make repeat visits. I mean, sometimes that does is that to first approach an idea to them and then to keep going back. The other thing is, as you discuss this with them, their primary fear about discussing anything to do with MHM is that you'll actually get into the whole, sexual health, sex, pregnancy, and I think that intimidates them. But one way that we have tried is to say, yes, these are relevant issues. These will come up. But the reason why we're working on menstrual health and hygiene is because this is a normal part of every adolescent girl's life. And the thing is, if they're not able to manage that, it's going to affect their attendance in school. It's going to affect the way they're able to sit in class and pay attention to something. They may not be able to complete an exam. So it has potential, implications for their ability to stay in class and attend school on a regular basis. So this is why, and to say, unfortunately, we will have to acknowledge that issues related to sex and pregnancy will come up, and the fact that it will be dealt with in a sensitive, fact-based manner. We can't say that this will not come up, because it does. But to say that it will be dealt with sensitively, facts will be provided. This is not to sensationalize anything or to drive girls to engaging in teenage sex. So I think that we need to identify those fears that they have and perhaps address them a little more directly, but also being sensitive. The other thing which we have tried is sometimes to say, introduce an element of competition. In that district, all the headmasters have given their permission to do it in their school, and we'd hate to see this particular block fall behind. So how about we do it here as well? So I think that helps. The other thing is that if none of this works, you have platforms such as MHD, and inevitably somewhere in a particular city or in a district or even in a block, someone is doing something. And to invite these particularly resistant masters, whoever, to those events and let them see that other people in positions of authority are doing something on this issue and they're not shying away. So I think these are some things we've tried. Some of them work more than others, but just some ideas.
Okay, it's a great question, and Nirmala also posted it would be great to have a webinar just to not always look at girls, but also how to work with how to get others involved. And I'm really conscious about time because it's now 50 minutes past our 1 hour. If you want, you can still post your question here. We will have the next webinar. I'm sorry. Oops. If you still have a few questions, please type them in the chat box so we can answer. As we said, we wanted to have a dialogue and not only presentation, and I think it partly worked out, but we strive to be a bit better for the next webinar. Arundhati, can you skip the slide to the next webinar? Yes, big thanks to everyone.
We need to stop presenting, go back to her, stop sharing. Hold on, Ina.
Yeah, and the next webinar will be on 14th January, and it will be about taxation on menstrual products. For example, also in India, you recently removed the taxes on menstrual products, and some other countries have done that as well. And there's been some really interesting perspectives and learnings if they really reduce the costs or not, and what are other additional campaign measures you need to be aware of. So that is in January. And we have done recording of the webinar, so you will see a recording of this, and we hope to be in touch. And we took a lot of good learnings from today, especially good suggestions around engagement, good suggestions around content, but foremost a suggestion around creating a repository so you can access it. And yeah, I think the Menstrual Health Alliance India will discuss very clearly how to do that.
So if anyone, thank you so much, Ina, and a real big shout out to Ina for partnering with us for this web dialogue series. But we also want to make sure that we are responsive to suggestions and feedback from all of you who have attended. So other ways that we can really make these web dialogues far more interactive and more responsive to what's happening in the sector. Please do share your comments and suggestions with Tanya, me, and with Ina, and we'll definitely try to incorporate this as we do these web series into 2020. Thank you very much, all of you, for joining. And take care, Ina.
Thank you. Goodbye, everyone, and see you for the next web meeting. Bye.
Bye.
जातोय ना मी देऊन जातोय थांब ना 2 मिनिटं
तू देऊन जातोय
हा 2 मिनिटं थांब
Können die untereinander diskutieren?
Ja, theoretisch, du kannst auch untereinander Messages schreiben.
Aber auch reden?
Nee.
Okay, das waren ja dann irgendwelche anderen Stimmen.
Ja.
Wenn am 14. das nächste Webinar ist, soll da dann der David...
Ja, das müssen wir nochmal planen. Oh, das war technisch, das war so scheiße.
Ja.
Das war echt, das ist echt schwierig, weil Nummer 1, alle Sprecher müssen halt immer eine Viertelstunde früher da sein, um Audio zu testen. Und die können nicht irgendwie erst auftauchen um die Uhrzeit und dann funktioniert deren Audio nicht.
Aber das war gar nicht. Also,
ja, 2 von denen waren nicht und die Moderatorin war auch nicht. Dann hatten wir halt dieses, dann hatte ich die falschen Slides hochgeladen. Dann funktionierte aber besser, wenn es die Slides auch machen, die das selber handeln. Und einer muss halt immer muten, unmuten, weil du kannst halt nicht alle...
Das war anstrengend.
Das war halt anstrengend. Du kannst halt nicht alle...
Vielleicht können wir das nächste Mal so machen, dass ich das organisiere. Also weil dann kann ich gucken, okay, wer meldet sich und du kannst eher so dich auf das...
Ja, das ist irgendwie...
ja, ich habe tatsächlich auch vieles nicht verstanden.
Ja, weil es halt auch super indisch mit ganz vielen Vokabeln und so.
Man hört
Nee.